In ancient Egypt, if you broke your arm while building a pyramid, you were in luck. Egyptian medicine was the trauma center of the ancient world. While their mythology was filled with gods and spells, their medical texts tell a completely different story, one of clinical observation, logical diagnosis, and surprisingly effective surgical interventions. The star of this show is the Edwin Smith Papyrus, dating back to roughly 1600 BCE. Forget magic spells, this is a textbook. It's organized like a modern medical chart: examination, diagnosis, prognosis, and treatment. It deals with traumatic injuries, fractures, dislocations, and wounds. It's here we see the first recorded descriptions of the brain, the meninges, and the cerebrospinal fluid. For a surgeon in 1600 BCE, this document was the difference between a patient living with a set bone or dying from an infected, gangrenous limb. The Egyptians didn't just fix bones, they built the first massive pharmacological database. They understood that nature was the ultimate lab. Honey as an antibiotic. They didn't know about bacteria, but they knew honey stopped infection. Honey is hygroscopic, it draws moisture out of bacteria, and has a low pH. It was the ancient world's most effective topical antibiotic. The poppy, for pain, they used extracts from the opium poppy. It was the precursor to modern morphine, a necessary tool for a society that performed serious surgical procedures. Willow bark, used to treat inflammation, essentially a precursor to aspirin. Egyptian medicine was a hybrid system. They had the SW&W, physicians, who dealt with the physical body, and the Asu, healers, who dealt with the spiritual/magic side. Think of it as the original integrative medicine. If the physical treatment failed, or if the disease was invisible, like a fever, they turned to the spiritual. It was a recognition that illness isn't just biological, it's also psychological and social. Did this make them live longer? Again, we return to the bottleneck of childhood. However, Egyptian physicians were likely some of the first to recognize the prognosis. Their texts often listed cases as an ailment I will treat, an ailment I will contend with, or an ailment not to be treated. They practiced triage. By accepting that some injuries were fatal and focusing their resources on those who could be saved, they managed the health of their workforce with remarkable efficiency. They were the first to recognize that medicine has limits, a crucial step in the evolution of professional ethics. The Egyptians taught us that if you want to master medicine, you have to write it down. By documenting their cases, they built a library of human experience that ensured the next generation of doctors didn't have to start from scratch.